Hey everyone, Dr. Reams here with Dr. Reams Concierge PT. I'm here today with Ben. He works with Tactile Medical with a pneumatic pump device. He's going to tell us a little bit about it. I get to wear it, hang out, try it out for a minute. And he's just going to walk us through what makes their pump so good and so unique.
Right, so again, my name is Ben Baxley. I live in Chattanooga. I cover East Tennessee all the way up to Knoxville, and I work with all kinds of patients with lymphedema. Majority of them are breast cancer related lymphedema, and that's where this comes in. This is our upper extremity device garment. So what I'm going to do is I'm going to put it on Kaylee so you guys can kind of see how it works. So the first thing I'm going to ask Kaylee, because this is a left arm device, I'm going to ask her to take off her watch and her wedding ring and just switch it to the other side or put it somewhere safe. Perfect. And then what we're going to do is we're going to have our sticker arm right in here.
And one thing to note is this is the sample, right? So when they come, they try and make sure that they get the right size for you.
Right. So this is not going to fit her perfectly, but it is going to give her an idea on how it works and for you guys as well. So this is the chest flap. It's going to go right over the chest. And then this just kind of pulls over. A lot of patients, what they'll do is they'll put their hand in this right here. So we can go ahead and unbuckle it and get that extra tight little squeeze.
I got a flipper.
There you go. Perfect. Awesome. And then what we'll do is we're going to tighten up the arm just a little bit. We want it where it conforms to the body, but we don't want it so tight that it's putting too much pressure on the lymphatics, because this is supposed to mimic MLD massage, which is what Kaylee here does with patients. And MLD is supposed to be very light because the lymphatics are just a couple millimeters under the skin.
Yeah, and what's cool is, so they'll put a sample on you so you can kind of see what it's like. Then once you get approved and get your own pump, they fit it to you. So you don't have to go through this every single time. It's much easier to put on yourself afterwards.
Right. I always tell patients, that I'm going to make it look a lot more difficult than it is. And it's because this is a demo device that I use for other patients. Now, I clean it in between uses, but this is kind of like just a demo garment that we use for multiple patients. When we ship the device to you, it actually fits you. And we actually have a patient trainer who will come to the house, take it out of the box, and make sure that you can put it off and on and off correctly, that you know how to use the controller, and that you're comfortable doing your treatment every day. That way it's really convenient for you.
So don't get lost in the setup. It's much easier.
That's right. That's right. So if you want to kick back and relax.
Now most people will do this when they're sitting back watching TV just before they go to bed, hence why I'm now going to hang out in my little chair over here.
Right. And what I'm going to do is I'm going to put it on a program called Full Arm. It's actually, arm and shoulder. And that's going to make sure it hits. It's actually going to start hitting this area. It's going to decongest these lymph nodes right here in the axillary. Then it's going to work its way up. So it's going to work your shoulder, go to the bicep, forearm, and wrist, and then go all the way through. How's it feeling?
Feels good.
Good.
So when you look at the manual lymph drainage that either you watch or I've taught you, or hopefully your lymphedema therapist has taught you, is you decongest the trunk first, right? Clear those pathways to take on that fluid. This pump mimics that, okay? And it's very important. Now there is settings that they can put on if you're short on time, right, to kind of jump through that. But the full treatment really tries to mimic what you were taught from your lymphedema therapist.
Right, so not only is it going to include that upper extremity piece, but it's also going to include this fancy pair of shorts right here. They're high fashion, they're they're high-waisted, and basically you're just going to slip these on. It's real easy. You just Velcro and close, and it'll actually tighten up around your thighs as well, but it's meant to overlap with the device to help move that fluid all the way down to the center of their body. So not just across the arm, not just across the shoulder and up under the arm, but actually, just like when Kaylee works with you, it's going to massage down in this area and decongest so that we have somewhere for that fluid to move.
Remember, we don't want the fluid just going to one other set of lymph nodes. We want them dispersed to other ones we can reach so we don't overwhelm another system, right? If we were only going to the other side of the chest, this side can get overwhelmed easily. So really taking advantage of the other sets of lymph nodes, really important.
Mm-hmm.
And so right now my chest is all puffed up and I can feel it working through here. They have smaller chambers than other pumps you guys have seen with me, and so it really incrementally works. You may not be able to see it in the video. We'll kind of pull up probably the head and neck. You'll be able to see the delineation on. but that it really truly incrementally goes, and talk about how that kind of pressure builds.
Right. So what we call it, so we have what's called static compression, then we have dynamic compression, which is sequential. So unlike my competitors, this device has 32 chambers alone in just the upper extremity piece. Most of the competitors have about 6 to 8 chambers, and it works in a static hold where it'll squeeze and hold, and then it'll kind of move up to the next area, squeeze and hold, move up, squeeze and hold. But what this one doing is it's actually mimicking a lot better what Kaylee does. So it actually feels like fingers, but it's a sequential hold. So it'll get real tight, and then it start to inflate the next one, and it starts to basically feel like a finger roll, which is way better for these patients because it's actually going to stimulate the lymphatic system. So another cool thing about this device is it's actually Tactile Medical, the Flexi Touch is what we call this. This is the only product that clinically has been proven to stimulate the lymphatic system. Others will do a good job of moving that fluid, and sometimes a basic pump will do the trick. However, we have a lot of clinical research to show that this one does, and it does it every time.
They have a lot of people on their team that are lymphedema therapists that have put in extensive research, not just another business company trying to get into the lymphedema world, but people who have been in the world trying to improve that world, right? Have had lymphedema themselves, have treated it their whole life, stuff like that. And some of the other companies do have some of that, but Tactile really prides themselves on research and having team members like that.
Right, and so we are the biggest lymphedema company in the world, technically. Biggest in the United States and therefore the world. And we have huge teams of like payer relations, patient advocates, a lot of people centered around getting patients with lymphedema the best continuing care after you go to a lymphedema therapist. Lymphedema therapy is still the gold standard for lymphedema care. However, after therapy, this is an amazing option. It's basically bringing Kaylee home with you when you're done. So somebody to have a way to do the MLD massage once a day, and it's an hour at a time. So most people do this in the afternoons or evenings. They'll kick back, watch whatever series they're running through on Netflix right now. Do it for an hour. Tell the kids, hey, this is my time. I'm going to do my therapy. Just have that time to yourself. It's also really relaxing. So that's another good reason to do in the evening too. So if you teeter off and let's say you fall asleep while you're doing it, it's going to run its course and then it's going to cut off. So no worries there, but a lot of people will do this in the evening for that reason.
And I notice when I do manual lymph drainage patients, they often fall asleep. So I know that happens, and I can see why with this machine.
Right.
Getting it done, it's like, okay.
It's very, very comfortable. And in fact, this is the older garment. So we actually, we've got some in the works right now. They're going to be hitting the market this year, but they're actually the same garments. However, they have a cooling material in there to make them even just a little bit more comfortable. And a couple of them have zippers to make it a little bit easier to put on and off. That being said, this is extremely easy. It's just once we've got it set to you, like I said, I make it look a lot more complicated than it really is, but once it's fitted to you, it's about as simple as putting on a jacket.
And so those, we've talked about in other ones, those who have it on both sides and stuff, it's best to still stick with the one arm, right? Mm-hmm. And so we often get asked, can we do it to both sides? Yes, but you want to do it separately because you want this arm to be able to manipulate anything. Let's say my dog started choking, I needed to get this off really quick, right? Mm-hmm. I have this arm free. If my arms were both pumped up, I'd be a mummy. Yeah. Not very easy to move. So they do have to where you can do both sides, get both sides, but not at the same time, just for safety reasons, mm-hmm. That you would switch garments. But talk a little bit about kind of some of those preset, like right. Maybe we're swelling in their hand or something like that.
So we've actually got different sets. So right now it's hitting, this is our arm and shoulder program. Now when you wear the shorts, it's going to be called full arm and core. So this is a supplemental program called arm and shoulder. This one's only 50 minutes. We've got a full arm that just hits the arm, that's 30 minutes. We have a hand treatment that's 10 minutes. But we can customize this based on the patient. So, let's just say we've gone through a ton of radiation. We're very sensitive and right in this area, right in our chest, right? So what we can do is actually lower the pressure right there and have a treatment program set up to where it's really easy on this area, but we are getting that lymph drainage and that we are clearing all the way to the trunk. Also, let's say you come home at the end of the day, you really don't have time for a full hour, but you do have time to hit that full arm. Well, that's a 30-minute treatment. We can go ahead and have that preset in here to where you can just throw on the device, hit the arm real quick, and carry on with your day. Now, it is important that you do the full arm and core once a day, but there are those times where things happen. So it's nice to have those supplemental programs in there. It's also nice to be able to customize it to the patient. For the most part, most patients will need full arm and core. However, there are some patients that have special needs that we can modify these programs to help fit their daily lives and help them the best.
Like I have one patient who does the full treatment in the evening, but does a partial in the morning to kind of help with just that problem areas she has.
Right.
And then the full treatment in the evening because that's when she has time, right? And so that happens. Now, I don't think I've ever asked you this question, or if I have, I've forgotten. Yeah. What about those people who don't really have the swelling in their arm, more so just in their, breast, armpit kind of area right there?
So it's still important to hit the arm because we still want to carry that all the way through. However, we can focus the treatment a little bit more on this area, a little bit heavier handed on this area, and a little bit less spending time on moving that fluid throughout the arm. However, it is important to go ahead and hit everything because, again, like you said, it's not about hitting it just a few lymph nodes. We want to disperse that fluid as best we can in the center of our body. Get it across those. We've got watersheds throughout our body, so we've got one here, we've got one in the center of our body, we've got one here, and we want to make sure that fluid's getting into those regions where it can find healthy lymph nodes. That way it can be drained.
So even if you're just having swelling in the armpit breast area, that area is what drains the arm. So you may not see swelling in your arm, and you may never see swelling in your arm, but by doing this, it's going to help prevent getting swelling in that arm truly. So it is important to still do it.
Right.
So that's why you will still get the arm piece when you just have breast swelling. Okay? So I bring that up.
Yeah, no, that's a great point. If you want to stand for just a moment, I want to bring the controller a little closer to the screen. We've got plenty of slack.
Yeah, we're good.
So this controller is super easy. So it's only got 5 buttons on there. Cool thing about it is once you started a treatment, like she said, if there's something going on with the dog or you got something going on, you got to pop up real quick, you can just hit pause, take that garment off. You can leave these hoses plugged in, throw it back on, and it's going to start off right where you left it off. So you don't have to restart that hour if for some reason something happens. You can stop it and then, come back. It is important to try to do it for the full hour, but things happen. So it's nice to have that feature. Also, I'm going to show this as well. So we're going to stop the treatment. This is the different settings. Yours is going to come pre-programmed already. For you specifically, I've got a bunch of different programs in here because I see all kinds of different patients. But specifically for you, when you get yours, we're going to put in the supplemental programs that are appropriate for you in that full arm and core. That way you just turn it on and then hit the first button you see, and you can go ahead and start the treatment. So I just put hers on the full arm so you can kind of see that crawling up.
Yeah, you can see it inflating here, and then it'll deflate slightly after.
Right, so it's a sequential movement, and what it's doing is it's slowly, lightly massaging that fluid up her arm. So this is typically towards the end of that full arm and core treatment. After it's hit up in your trunk, it's hit up under your arm, it's going to switch to your arm and help move that fluid all the way up and across. So decongesting this area and then draining all the way through.
Making sure it's getting where it needs to be.
Perfect.
And sitting down relaxing with this up is much better because it's going to help that fluid drain rather than standing here like this.
Right,
More comfortable, but also helps with gravity.
Right, yeah. Yeah, it's already fighting for its life trying to get through those lymph nodes that are getting congested. The last thing it wants to do is fight gravity too. So that's what this kind of looks like. I turn, you can see through the back, there's chambers and all that stuff back there as well. So that's kind of what to expect with Tactile. Okay, so we'll turn that one off. So that is if someone more than most likely came from breast cancer, right? Has breast cancer related lymphedema. So that's what that garment will look like. Of course, there's other surgeries that can happen that will relate, that'll cause upper extremity lymphedema. But one of the things that Tactile, they're the only ones that have a head and neck lymphedema garment. Okay, none of the other ones have it, and so. Just so you can see it on a patient, that's what it looks like. It's a little intimidating at first. This guy looks like he's about to go to space. But it actually does an amazing job on clearing out head and neck related lymphedema. So a lot of that swelling they have up here, most of it's actually internal. Almost go back.
There you
So most of it's actually internal. So a lot of these patients with head and neck lymphedema, they have a hard time swallowing, they have a hard time with speech, difficulty chewing, difficulty breathing. It's really low quality of life most of the time, and it's because that lymph fluid's backed up, just like it would be in your arm after a mastectomy, after breast cancer. These patients get it backed up in their head and neck, and most of it's internal. So what this device does is the same sort of thing. It just helps massage this area, decongest first. You wear a big vest, and then it switches to the head to where it can drain that fluid, and we see amazing results with it.
And again, it looks like a complicated piece, but they go through, they make sure it's really easy to put on for you. You are comfortable doing it. All the same type of settings to where there's the specific, if you just need a real quick, just to drain just part of the face instead of getting all the lymph nodes going. There was my dog. Lucy's little cameo. And so same way to make it as simple as they possibly can for you, and they are there for you to answer questions. They have a great team that, hey, I don't feel like this chamber is fitting as well. You remember that with that one patient?
Right.
And we just had to adjust one strap.
Exactly.
And all of a sudden they could feel it. Right? And so sometimes there's just little things that throughout time it shifts or moves, or you lose volume in the face, so the strap just needs to be adjusted, or in the arm. They're there for you. So reach out and ask those questions.
Absolutely. We'll come out as many times as we need to. We've got a whole training team that comes out and follows up with these patients, but I'll even come out and follow up with them as well, because if it's something that I can help you with real quick, it's no time out of my day to come by and make sure that you're getting the home therapy you need.
Yeah. So one thing I will do is in the description of this video, I will put Tactile's link, so that if you're not in the Chattanooga area, how to find a rep and how to do that. But getting a pump, usually you go through one of your doctors, right? Whoever you're seeing, oncology, radiology, surgeon, primary care, vascular, whoever it may be, right? They can order them. If they aren't comfortable with it, right? You can reach out to Tactile, and they often have some advice in that region. Physical therapists, certified lymphedema therapist, whether they're an SLP, speech therapist, occupational therapist, physical therapist. There's a lot of people that can help facilitate getting these pumps.
Right.
But we usually need a doctor's signature to have insurance help cover them.
Right, and even if you're just curious, go on our website. There's a place in there for patients can put in their information, and they'll get in touch with the right rep. So I cover Chattanooga to Knoxville, but if you're outside, if you're in Nashville, they'll get you in touch with Natalie, and she'll help you out. We've got reps all over the country. So
they're going to know that region and make sure they help you get the right one. Because even as a PT myself, and I want to order a pump for a patient, the doctors will go, oh, I don't do that. You go, no, I'll take care of all of it. I just need your signature. So the reps can help facilitate that. If you don't know what to do, they can help kind of facilitate that process.
Right.
But they will always check to see what insurance can help cover of the pumps.
Right. We'll verify your benefits before we talk. That way when we meet, we can go over what your insurance is willing to pay, if all of it, or if you have a copay, how we can help with that copay. 9 times out of 10, these patients have $0 copays. And if they don't, we can work with you to make it as affordable as possible so that you get the continuing care you need after lymphedema therapy.
Yeah. And so that's a big piece, and I've talked about it in all the videos I've done with pumps, is this is in adjunct to therapy. This does not take the place of.
Right.
This is another tool in the toolbox to help make managing that much easier.
Right.
All right, y'all, if you have any questions, reach out to me. Like I said, I'll put Tactile's information up there. If there's a question I can't answer, I'll reach out to Ben, and we'll get it taken care of.
Perfect. Thanks, Kayla.
Thanks, Ben.